the format is that I'm going to first briefly introduce our, all of the panelists. And then after that, each one is going to give their opening remark. After that, we will present a series of questions and asking their professional opinion. And finally, we'd like you to have your own question, and maybe you can specifically ask a particular panelist to answer, or just post a general question to the whole panelist. Okay, so now let's start it with. Now this is the panel discussion, healthcare and consumer electronics at the IEEE ICCE Berlin 2013. And I'm a professor at the radiology department of the University of California, Irvine. And I'm also the director of medical imaging and informatics. And now I'm also the professor of electrical engineering of Chang'an University in Taiwan. And Chang'an University boasts the largest hospital chain in Taiwan with over 16,000 hospital beds. So we have lots of interesting medical research and practice going on. And okay, now let me introduce each of the distinguished panelists. Okay, the first one on the farthest end is Professor Yoshida. And if you attend the last, paper presentation, you probably already know him. But I just repeat his credential here. Professor Yoshida, he obtained his bachelor and master degree in physics and PhD degree in information science. All of them are from University of Tokyo, which is a very prestigious university. And he first joined the University of Chicago, and later on, now he is an associate professor at the Harvard Medical School and also the Massachusetts General Hospital. He is the director of a 3D computer-aided diagnosis laboratory. Also, he serves as consultant to many of the institutions. And also the associate director of radiology computer-aided diagnosis laboratory. And he also served as the organizer for various of the professional conference, and the list goes on and on. I don't have to elaborate on this one because of time. Okay, the second one, Dr. Y.Shieh, he graduated with a bachelor degree in physics with honor from Northwestern University of the United States. And then also a medical doctor degree from Stanford University School of Medicine. He is currently a surgical resident and research associate at the Russian Medical Academy of Postgraduate Education based at the Boltkhin Hospital in Moscow. He has engaged in research and published in peer-reviewed journal conference in the fields of high-energy physics. Well, actually, he spent quite some time doing research in the CERN, C-E-R-N. All of you know that. And also his research in teleradiology, gaze control, user interface, functional MRI methods, and clinical studies, and neural monitoring and other state-of-the-art device and methods in the thyroid, parathyroid surgery. And he is interested in the application and the development of new innovations, methods, and devices in the healthcare and surgery. The third one is Gupta. He is very special. He is an access technology consultant in Boston, Massachusetts of the United States, specializing in integrating of accessibility in product development and usability processes. He completed his master degree in system design and management from MIT. He has served advisor for several assisted technology projects within MIT, as well as corporations in the financial, media, and healthcare institutions. Notably, in 2005, he directed the development of the world's first portable reading machine for the blind, and because he himself has the limitation in his eyesight. So it is very relevant that we have an expert that he can talk not only from technical point of view, but also from his personal experience point of view. Sunish is a senior member of IEEE and currently serves on the board of Consumer Electronics Society and chairs the Home Health Initiative. Now, the fourth one is Professor Johannes Kraus and Doctor, yes, of course. Okay, in the medical school field, the medical doctor likes to be greeted as professor, because professor carry a prestigious position than the regular doctor. Okay. Okay. Now, originally, it is Professor Dr. Wolf, but he just accidentally have something emergency. He has to rush back to take care of that. So Professor Dr. Kraus is going to be the substitute. And unfortunately, I don't have enough time to correct his information. All I know is that he is one of our keynote speaker and has excellent credential. If you want to know more, I think the easiest way is just to Google the internet, and then you can get all the information. Okay. And yesterday we already saw his excellent presentation of all the medical device on a very comprehensive view. Now, the last one is Professor Dr. Ralph Brederlow. Okay. Yes, I say that, right? I say Professor Dr.
No, I'm not a professor.
Oh, okay, I'm sorry. But from my point of view, you have the same level as the professor. Okay. Yeah. And he has a master's degree in physics and a PhD degree in electrical engineering from TU Berlin. Okay. Okay. And he started his career at Siemens and later Infineon Technologies as designer and technical project manager in various R&D organizations from 1999 to 2006. In 2006, he joined the Texas Instruments in phrasing, responsible for design of analog, digital, and memory IP for TI's ultra-low power microcontroller product families. And since 2011, he has managing many of the R&D and the new technology development within the TI. He has authored many technical publications and 10 patents. He is currently the Vice Chair of the European Solid-State Device and Circuit Steering Committee, also acts as the member of Imager MEMS Medical and Health Subcommittee of the International Solid-State Circuits ISSCC and the Medical Technical Program Committee of ESSCIRC. Okay, so, well, I hope that I impress you with all of the distinguished credentials of all of our panelists. Okay, now I'd like to just have a brief overview of this. Say, today we are talking about consumer electronics and also the healthcare. Now, if we look at the traditional definition of consumer electronics, this is what it says. It says that any device containing electronic circuits that is intended for use in homes by general consumers. It is not intended for use in other industries or by various professionals. It is also typically involved in telecommunication device. So you can catch some of the keyword is that it is used in home and it is intended to use by the consumer themselves. Okay. Now, if we look at the healthcare, it's quite different. The definition says that it is the prevention, treatment, and management of illness and the preservation of mental and physical well-being through the service offered by the medical and allied health professionals. So you can, again, you see that the person involved actually is a team of highly trained medical and allied health professions. Okay, and also what is happened is normally it happens in a clinic and a hospital. It's not at home. Okay, and if we contrast, we can see that one is who, where, what. Who, the general consumer versus the medical professional. Where, home versus the clinic, the hospital. And what? One is the entertainment. Basically we want to have fun. Just extend our normal living capability. Okay, extension of the normal functionality. But the other one, is the prevention or treatment of the illness to restore the normal functionality that we lost. So that's a very simple and rough contrast of these two. But now this gap between them has been narrowed and the division has become blurred because the new generation of consumer of healthcare, those patients, they are all highly educated and they want to get involved in the managing of their own health care. They want to have a say of how their health will be managed, rather than just trust this 100% to the physicians. And where is that now with all the patients getting aging and most of them suffer from the chronic illness, and they have indicated a strong desire that they don't want to stay for an extensive period of time in the hospital. They like to stay at home. Okay. Now, what is that we talked about? CE is to enhance the normal functionality, and healthcare is just to restore back to the normal. But now with the aging, now what is normal functionality is kind of relative, because when you're getting old, everything is getting slowly decayed, but people will not admit that they are abnormal. Still think that I'm normal, but that level is kind of decayed. So it's kind of relative. So enhance and recovery, it's kind of maybe have some degree of overlapping. So this is my opinion. Maybe experts can have a different interpretation. Okay, so now today the main theme is that we have two fields. One is healthcare, which is facing a challenging problem and issues and asking for help. On the other hand, the consumer electronics has a lot of technology in their bags, and they are looking for new applications. So the purpose of this discussion is that we try to have experts from both fields try to join hands to see how we can achieve a synergetic impact to both fields. Okay, so I will pause here, and after this we will ask each of the panelists to have about 5 minutes of opening remark about your overall opinion from your perspective. Either way.
Okay, so I've prepared a few slides as well, so I need to pull them up first. It's this one. Okay, very good. Thanks a lot. Okay, yeah. Well, I think we have heard this a lot in the last 1.5 days of this conference already. Our population is aging, and I'm taking the position here of the semiconductor industry, of the microelectronics, of the hardware side. And for the hardware side, this means this is a growing market. The growing market means that's an opportunity, an economical opportunity. And let me, in my statement, tell you a little bit what I think is possible on the one hand side, but on the other hand side, it's also necessary to make this happen. Because first of all, you see these people, they feel quite comfortable here, and I think there's no reason for them to change anything as long as they don't have problems. So in fact, today, the system starts at a point when we have problems. And the question is really, do we need to start when we have problems, or shall we start earlier? But on the other hand side, why shall we start if we don't have problems? So this is really a conflicting statement in this whole business. So a good market is on one hand side, but on the other hand side, there also needs to be a demand. And the question is there a demand? I think in terms of population, for sure, in terms of what we could get if we do this, just thinking long term, it's also clearly a market, but on the other hand side, how to get there is a challenging topic because we need to change society. I'm taking this picture here. Again, the point of view is the one of a hardware industry person, and I think the center of healthcare today is here, in the doctor's office. Oops, this is too much. Place. Okay, the center is the doctor's office, and the doctor is an expensive person. He's an expert, and he needs to charge to his patients. So from an economic point of view, again, this is already an expensive part if the doctor spends time with a patient. If something really gets wrong, you're going to a hospital. The hospital is even more expensive. And on the other hand side, you can see there's a trend from year to year. This is a few people. This is much more people who are going to a doctor. And in fact, this is everyone. So today we have a few chronic diseases which are monitored constantly. The most important, maybe the blood glucose monitoring, the diabetes. That's the problem number one, which is used by electronics, and that's also where our products are broadly in. But I think that's just a very small piece of what you could do if you could basically give. Oh, sorry. not familiar with this, if you basically would give every person in the world some simple medical monitoring device which tells him now it is time to go to a doctor because something is going wrong, and it doesn't cost anything, and it's basically don't hurt you at all because you don't even see it. Else, in any case, except for the case you have a warning. And then we have a big market. We have something which is useful for everyone, and we can basically offload a lot of the work which is currently done in the doctor's office, and also some of the cases which have to go to hospital, because simply we prevent them to happen. And that's something which is good for everyone in society, and it's a big market. So I believe this is where we need to get. There's a lot of things to do. There's a lot of infrastructure. I'm not an expert on this. The hardware side for this infrastructure, I think, is already present today. It's mostly the software and the behavioral skills, the way how the work is organized, how the treatment of elder people is organized, how the treatment of any disease is organized. That's something which needs to change for this. So it's really a big challenge to get there, because there's a lot of things to change in a big part of our society. But it's possible, and I think from a microelectronic point of view, I will show later in my keynote speech that there's definitely a few things to be done. But technically, almost everything is feasible today. And the gap towards what we can do and what is feasible today and what we need for this market in the future is not so big. So this shows you a few examples of what is existing. I think miniaturization is a big issue, especially if you talk about what is here today, blood glucose measurement or blood pressure measurement. In this way, it's most likely not as convenient that everyone wants to use it if it doesn't need to. That's where we need to change something. But this is feasible. And last but not least, I'm a representative of the semiconductor industry. And the semiconductor industry has shown us that you can drive very big markets by simply believing into something. And what you can see in here is a report from the ITRS roadmap. That's the Semiconductor Industry Association, where all the big semiconductor players are sitting together and discussing about what is needed for the future in terms of equipment and software and so on and so on. And with this driving force, the semiconductor industry managed to constantly get 2 to 3x, or every 2 to 3 years, a 2x reduction in feature size for the basic logic technology. In this way, making the devices cheaper on the one hand side, or at the same price, offering more functionality. And this, every 2 years, you're basically doubling the growth. And that's something on the other hand side which is driven by the fact that you're enabling a much bigger market, and in this way you basically have a sustainable economical picture which allows you to extend the market. I think, and this is the vertical axis here, by integrating a few more functions, sensors, actuators, PO chips, also the analog RF on the same chip, taking the cost reduction possible in here, you can enable very intelligent devices at a very low price, which are basically affordable for everyone on this planet. And that's a very long-term vision, but in the meantime, there's a lot of challenges, and I guess a lot of these challenges will pop up and have already popped up at this conference. So that's basically my starting statement. Hand over to you.
So I don't want to say so much on the topic again, because I already forced you yesterday to listen to my words about 1 hour. But I just want to show you 2 of the slides of yesterday. So just to tell you what my opinion is and what our goals are at our chair. So I think what we need, like Mr. Brederlow said, is a kind of a doctor in the bag, a medical assistant anytime and anywhere. And I think we don't have to discuss so much about the costs all the time. The costs are important, yes, but I think which is more important is that the medicine is getting better. That just we want to improve healthcare with our systems, not so much looking to the costs of the system. That's another point. And I think we have to emancipate from the classical system. So what Mr. Brederlow said is a doctor-centered system. At the moment we want to let the patients participate to that therapy. We want to build an interactive system. But what we should not forget is the motivation of the patients. It's I think we should spend a lot of time to motivate the patients to use that equipment, because that's a very crucial point, and it's not so easy because many people, they don't even think of using that equipment. There's a small group who will use it, and it could be that in the future, health insurances will force the people to use it, which is not a very good development. So we should think a lot, how do we motivate the patients. And I want to point out a second thing. I just want to pick up a bit the discussion that was opened by Scott Linford yesterday. I don't know if he's here at the moment. He just asked a bit for the ethics of everything. So I just show you again the funny pictures with this consumer electronic implant, this ticketing device that you can put in your arm, and you can enter with a bikini to a bar, and you get scanned there for the entrance, and you can even pay your drinks with it. We should discuss a lot, like Scott Linford asked yesterday, should we do everything only because it's possible? So we should think about that a lot. And we should ask, do people want these technologies, or do, for example, health insurances force these people to take them? And the last thing is about data safety. We should think about that as well. So we see that in the NSA scandal at the moment. There are many questions are open, and I think Mr. Brederlow will address that in his keynote afterwards as well. But that's a lot to think about as well. So that's it from my side. Thank you very much, and I give over to Mr. Gupta.
Good afternoon. Most of the points, they are covered in terms of what we are looking for, what challenges we face. I just want to point out a few things. In the healthcare system, of course, the system has been there for some time, and we know it is very much policy and regulated. So those have been good things in place. But now consumer electronic industry, where it's coming from, it is quite open-ended, not as heavily regulated. So as these things come into the picture, more consumer electronics enter the healthcare arena, it will be challenging to see how these things can work together in unison, both the mainstream electronics as well as integrated into the healthcare system. So in terms of the, as initially first thing it was pointed out in the first part of the presentation, the consumer electronics is always meant for the general consumer. So I want to point out the word general. So of course, when you're dealing with healthcare, there could be various types of disabilities, there could be various types of special needs. And today's technology can offer solutions, but when these solutions are put out into the hands of the consumer, we want to make sure that they work very well with all sorts of technologies, whether we are dealing with low vision or hard of hearing or some kind of physical impairment, or could be any of these combinations, because as we get older and older, especially in the 80s and 90s, there are multiple things going on in the lives, and it becomes very challenging to deal with not just one, but maybe even 2 or 3 disabilities can really make life a very difficult proposition. So consumer electronics, that's where it can play a vital role. With the programmability of electronics, with the advent of mobile technologies, and with the ease of use proposition. These 3 things are making it possible for consumer electronics to bring a very widespread change everywhere. And of course, cost does become a motivation for a lot of the healthcare providers, but we want to make sure that the 2 notable trends, one is the personalized medicine, and the other one is
related to how quickly you can have the consumer motivated to start using it, so behavior change. So the customer, the consumer, the patient is highly motivated at this point in time in history, and the technologies are ready, and we can provide personalized medicine to all these populations, which is really possible at this point of junction. Thank you, and I will invite the next panelist. Thank you.
Hello, good afternoon. I'll just be pretty brief because a lot of the major points have been covered. Just speaking from more of my background of being sort of a bridge individual who sort of has a foot in both the healthcare side and sort of the technical side. I think one of the major things to keep in mind is that a lot of times in these times of very exciting development, where I believe there's been a huge amount of new possibilities opened up in the world of healthcare and medical devices because of the drive from the consumer electronics world. It's important to keep in mind not to waste some of the efforts of development, and this often happens when the two sides have a disconnect or lack of common language. And so to just keep in mind that we need to work closely all the time with people who are able to speak both languages. Let's say in a way we have disconnects between the healthcare and engineering, and maybe sometimes the business development and practical aspects there, and also, as we mentioned, bioethics. And so just to keep close contact with these people who are able to bridge these divides and sort of act as interpreters between these various disciplines. And that's sort of one of my main focuses here. Definitely I think this is a very exciting time, and I'll just turn it over to the next.
Thank you very much. Thank you. It's great to have this panel discussion with such a wide range of experts on the same table. I wanted to pinpoint or more address some of the imaging issues, because that's one of the things I'm interested in doing, as well as I believe that the imaging, which is anyway everywhere and being used in many consumer products, are actually being readily transferable to a medical domain as well, which probably are not so well addressed in this conference and so far in the last two instances. If you attended the previous the talk of the session, then probably you saw this one, but this shows so-called virtual colonoscopy images, in which the images being taken from CT scanner, which is unfortunately not a consumer product, but the medical product being actually processed in order to find out where the colons are located. And then you are able to go into it to find out some diseases visually, but non-invasively in vivo, which is actually one of the most important arena of medical applications of consumer product. I'll explain why. I apologize that there are some glitches in the slides. I don't know if it comes from the computer or from the slide itself. But this is one of the slides I used to use several years ago in order to show what's going to be happening in the high-performance image analysis and diagnosis. At that time, for doing real-time medical image analysis, you have to have high-performance computer in a cluster format. So it's an expensive as well as not everybody is accessible. For just visualize the structure of the organs, then you have to have, of course, a special software package. But at the same time, you need to have high-end graphics engine, such as the one being sold by Silicon Graphics, which is also expensive. And then the remote display is available, but it's slow, as well as the PCs were not as powerful as it is today. And also those gesture-based approaches, which are again available but not very common. Apologize. So in order to generate some images like this one, which I hope is going to be showing up, maybe it's a little bit too slow. Maybe not actually. Okay, so forget it for the moment. I wanted to show this one to show how current the graphics card is able to actually handle this type of things pretty easily. But this shows again the slides are a little bit contaminated. But the development of the number of cores, which I got from Intel, essentially toward the future. Currently, the maximum number of cores is 64 on Phenom, but it's going to be more in the future. And then all those the high performance, in a way, a cloud and a tip type of CPU is going to be more and more used in consumer electronics, and then available in the medical domain as well, which essentially commoditize all those hardware needed for those image analysis and diagnosis. Currently, the image analysis is being done on a regular office PC, and the cheap, inexpensive, I would say, the NVIDIA card would be able to handle very complex graphics, which is good news, and which is actually the advancing some of the medical image analysis quite rapidly. I explained probably this trend is going to be more also in the future. And then as I talked a little bit in the previous session, it's going to be probably coming to the age of all cloud-based image analysis, and also remote rendering being done on the cloud, so that they are going to be delivered remotely on the mobile devices, which we have currently a much wider selection. Not only laptops, but also the tablets and iPhones, and also the other smartphone, thanks to the progress of consumer electronics. And then those cloud services are being developed primarily to serve for those mobile devices, but they have a very great opportunity to be migrated into the medical domain as well, in which those resources, commodity resources, are not very much used, beginning to get started being more heavily used than before for communication between physicians, as well as more importantly, between patients and physicians, which is going to be changing the landscape of the medical imaging as well as medical practice. And this shows one of the the demonstration project we did, which is a virtual fly-through of the column based upon the motion, the based navigation, in which if displays back well, unfortunately it doesn't. Essentially you are able to use gaming hardware and software in order to do the medical diagnosis. And in this particular example, virtual colonoscopy. Therefore, in the future, I'll see that this is going to be actually being sold being provided, I'd say, as part of the family video game, which I have been actually predicting and foreseeing and expecting for many years. The idea is the following: why would I be developing open source gaming software on Xbox, okay? And then you don't care, no, but your kid's gonna be playing with it, and your column is on top of the screen. And kids who find their dads and moms and polyps get points. Okay? So that they are able to, they don't have to go to the doctors. Okay? Instead, and they can consult your kids on the video game to find whether you have polyps or not. That might sounds very ridiculous idea, but actually it's becoming more serious. I don't have that actually paper on top of the slide, but you have heard of crowdsourcing. Essentially, we are able to use crowd human intelligence in order to find polyps. And then there are studies going on in my laboratory as well as in the other laboratories to see how lay people, like your kids, are able to find polyps better or with assistance of computer-aided diagnosis than physicians. Of course, so that's going to actually solve the human resource problem in the diagnostic imaging. Lastly, and probably the most importantly, those the TV technologies, which is getting better and better. And as you know, in the Samsung booth and in this IFA, they have a world's largest monitor, which has great potential to impact those diagnostic imaging because we are generating the high-dimensional, very precise, the high-resolution images. However, we don't have a means to display it and manipulate it at the moment. If they are readily available and then being backed up by consumer display like this one, which is going to be very expensive if it were to be produced as a medical device, then that's going to have a great impact and probably diagnostic precision as well to the medical imaging arena. Okay. In sum, the current and emerging technologies in computer and consumer electronics and communication as well have been substantially changing the capability and practice of the medical image analysis and diagnosis as far as I know. And those include high-performance cloud computing, high-resolution mobile devices. They are much higher actually than that of the previous medical device, medical displays, and 3D motion sensors in gaming technology, all put together in the right manner, and then it would be able to impact the medical arena in a substantial manner. Thank you for your attention.
Well, luckily, we have a slow laptop, so some of the video will skip. Otherwise, by the time the video are done, probably it's time for lunch. I'm just kidding. Thank you for very interesting presentation. So that concludes the opening remark of all the panelists. Now let's move on to dive into the details. Okay. Okay. Well, you all know that healthcare is very complicated. So if we want to talk about this from different point of view, we probably need to run the panel discussion all day long. Because there are so many different stakeholders. For example, we can talk about political aspects and how to set the best policy, or business aspects. What is the best business model? Is that HMO or blanket coverage of all the citizens? That type of thing. So today we are going to sort of confine to a focused area, which is on the technical aspect. So that means how can we accomplish the same task with better methods? Just like the famous Thomas Edison said that there is always a better way of doing things. So that's what we want to focus on and find that out. Now let's dive into the details. Now I just single out 5 of the crucial issues that we are facing. They are this. What happened? Okay, one. Okay, so this is the 5 crucial issues that we want to more or less focus for today's discussion. First one is cost, and the second one is quality of care. Third one is aging population. The fourth one is that the paradigm shift of caring philosophy from the treatment after the occurrence of the illness to the prevention before the occurrence of the illness. And the last one is the continuity of care. Okay, so now for each one we are going to show some of the subtitles and ask the panelists to give their specific opinion from their perspective. Now the cost. First one, the cost. Everyone is familiar with this because the healthcare expenditure has become an ever-increasing burden of the society. If we look at the figures of the U.S. Spending from national health expenditure, starting from 1969, every decade, it's tripled, and from 1999, every decade is doubled. So by year of 2009, the general government expenditure on health as a percentage of total government expenditure is 19.5%, and this number is still going up. So we can see that this could be a problem. So I list this. Say cost, increase the staff productivity, decrease the staff patient ratio, and better workflow, or telemedicine, or inventory tracking of expensive equipment and the resources so that the usage will be maximized. And of course there are others that which is open for discussion. So how about we start with Dr. Brederlow. You want to address any of this?
Well, I think cost has to be an issue in all cases, simply because the resources are limited, and I think cost is something everyone wants to do healthcare. Cost shouldn't be an issue, but the reality is, if you look at the macroeconomic picture, it always is an issue. So I think we have to take cost into account. Everything needs to be affordable. Therefore, I believe the best way to get through this is to really do prevention and to start finding problems as early as possible, because then it's typically cheap to get these problems under control. And we need to find ways to do this at a reasonable cost. I think that's, from my point of view, the most important, the biggest challenge we have to face.
I completely are with you, but I want to point out that the discussion about cost is a bit more complicated. Somebody told me yesterday in the evening, I don't remember well who it was, but he told me if the people smoke, they die early, and that's for the whole population. That's cheaper than when he lives a long life. So with these telemedicine systems, for example, we do a better medicine, but people are living longer, and we have some other problems with demographic change then. So the cost discussion is for me is more a political discussion. It's working via these increased productivity that we are lowering costs a bit. But if people live a longer life, it will cost a lot to the society.
So what comment I have is basically related to both in terms of cost. That's what microelectronics and consumer electronics can provide, is bridge this gap and bring the economies of scale. And by providing these economies of scale, these technologies can be provided at a very low cost to the consumers who could still be at home and do these preventive cares, which will not only prolong their life, but also the quality of their life. So that's what the cost factor comes in, where personalized medicine can bring in, because it's so much individualized, each of these programs, or whether they are mobile-based solutions, or whether they are managing your chronic condition, or dealing with some of the back office issues in the physician, records, accessing the records. Once these things get streamlined, they will become highly personalized. There will be more peer-to-peer patient sharing of systems. There will be more data analysis done. I mean, how many times last time your primary care physician was able to garner and gather all the information, put it together, analyze it, and give you a proper feedback. Imagine if that all is being done in the back office, and the analysis is not only shown when the doctor is ready to see you, but it's also sent to the patient so they can discuss more meaningful issues which matter more than anything else. So it will not only drive the cost down, but also improve the quality of care.
I also agree that these consumer electronics contributions in medical care will have a huge impact on cost. For one, as listed, the workflow improvement will be dramatic. Currently, when we use more traditional methods of paper and physical charts, there's often times where we lose charts or we misplace them, and there's people waste a lot of time looking for records, and communications problem. But once we have a lot of this integration with electronic medical records, for example, or telemedicine systems where everything is available from multiple devices at multiple places. This is just a very key element to decreasing the cost and waste. And similarly, telemedicine, there are examples where the shortage of experts in certain regions have sort of pushed this development, where you might have tele-consultations, and this can decrease the cost in the sense of trying to recruit some specialists to rural areas is a problem, and oftentimes to incentivize this, you have to pay huge salaries, and this is not realistic in many cases. And so telemedicine consultations is very important. And I think some of the issues there that have to be addressed are safety from, for example, telesurgical perspective. What happens when something fails? You have to have a way to allow a local surgeon to take over safely and effectively, even if they're not the same level of specialist, but they can at least complete the robotic surgery in an open procedure. So, there's some issues that need to be worked out in that perspective.
Well, I can echo Professor Crow's statement related to the longer the lifespan. As a matter of fact, there is a report showing that the U.S. Medicare, they spent about 30% of the expense to just take care of the last year of the dying people. So whether this is a cost-effective way to take care of the very sick older people, just to keep them surviving, whether that quality of life is good enough or whatever. I think this is probably something to think about. Okay, now let's move to the second one, is the quality of care. Now the quality of care, I think according to this IOM, it says that we have to measure it not only at the individual level, but also on the population as a whole. And also this measurement has to be backed up by current professional knowledge and also the clinical trial, have some solid number to support that this kind of practice actually improve the quality. And so there's some subtitles here, but the panelists, you are free to, say something outside of this also. I just mentioned that quality of care, people in the literature has listed that the mobile health care to achieve a ubiquitous and instant clinical data access that can have up-to-date and complete data. And RFID bracelet for quick and accurate identification of patients that will reduce any mistakes and also can smooth the workflow. And the drug prescription support and drug interaction checker, so that that will really help the busy physicians, that they don't have to memorize all of the complicated drugs, and it will be really helpful for them. And of course there are other things. So we will open this up. Who is going to address this?
So I'm going to say something. I think the improving the quality, like I said before, is the most important thing. And I think that nearly everything on electronics improves quality at the end, on nearly everything. And we just have to spend a lot of our knowledge in how do we make these things safe. So, for example, if you take these what you mentioned there under drug prescription support, there are many apps available on the market where you can calculate the anesthesia quantities, for example, and that's quite unsafe because they're just programmed, I don't know, anywhere in the world, uploaded to the Google Play Store or to the iPhone store. And my wife works in anesthesia. She's a medical doctor, and she just downloads it and looks in, and that opens a lot of problems. So I think quality is definitely gets higher with these new technologies, with all consumer electronics, but we have to take care about safety.
Yeah, development of standards will become the key, and how do we develop this credibility? Of course, there's a lot of different types of programs and apps are out there. At the same time, I think public opinion and input from physicians, there should be a rating scale developed by which these get rated, not only based on safety, but also in terms of are they following the proper guidelines. There are, even within the physician circles, there are different opinions. How do we confer that? So credibility and reputation becomes more and more important, and I think as we see this more adoption, I think this will automatically filter out, but the standard bodies, the regulatory bodies, they have to be vigilant and be on top of things.
Maybe, I think just taking this picture back to consumer electronics, I think in consumer electronics, quality is not the number one care. But I think in medical electronics, quality is something which can be easily a showstopper for progress. So I think that's something where we have to really see the difference between these two markets. I think we can learn from consumer electronics in terms of how we grow a market in the medical business. We have to be very different in the way how we adapt quality.
So I think I agree with a lot of the points made. There's a big concern in terms of quality of the innovations and concepts that are applied into medical applications. And yeah, I think there's a delicate balance between trying to encourage innovation by open sort of principles, but at the same time trying to ensure the quality and reliability that's required in the healthcare environment. But in terms of the healthcare side of the concept of quality of care, I think that this has already been demonstrated in many studies that a lot of these electronic medical records and other new innovations in healthcare, modern healthcare, have really helped to eliminate and decrease the amount of medical errors derived from, say, sleepy residents who cannot get enough rest, and they make certain errors, like forget to do certain things. And when we have systems that can remind based on objective data, this has already proven to be a big help in terms of quality of care. And again, just ubiquitous patient data, being able to access this from anywhere at the patient's bedside, pulling up images, diagnostic studies, different reports. It's all just a big contribution to quality of care.
Actually, from my point of view, of course I agree on a lot of points being made so far by the panelists. But I wanted to actually ask the panelists as well as the audience about the a little bit different trend being underway, at least in the United States and probably in many other countries as well, which is that there are the developments of social network, which is, of course, you're familiar with, something like Facebook kind of things. But there are many patient groups suffer from the same diseases. And interesting thing is that in my case, I often deal with cancer cases. But the interesting fact is that patients rely on their peers' opinion more than opinion from the doctors. And more interestingly, many physicians do not really know the existence of those peer-based patients groups. So if this may not be actually a little bit different from consumer electronics per se, but like music group or like the movie fan group or whatever things, it's a served things. But if the consumer electronics industry would be able to actually tap into those patients' self-support system and organize it, and then connect them together by some devices or the software or whatever, and then it could be actually the increase eventually the health quality of healthcare, as well as the patient information basis and continuity of the care. Are there any actually such a trend in Europe as well? The patients believe in their peers' opinion more than their physicians' opinions?
I can only speak as someone living here in this country and my personal experience, so I don't have really data who are representative here. But I think there's sometimes trends, and I think there's also sometimes, since you suffer from the same problem, you believe this person just because you're near to him. I think this is more kind of an interaction topic, and maybe the social network accelerates this.
I think it's the same. There are many of these groups, like internet forums, where people where patients discuss a lot about their diseases, and And I think it should be the big chance that doctors, like I said, discuss with them there. But that is, in Germany especially, it's not allowed. So in Germany, it's in the moment it's not allowed that a doctor tells you a therapy on the telephone, for example, or via internet. That's not allowed. So we have to improve a lot from the regulation side as well. But actually, I think it's yet a big chance if people discuss together, if the patients do and the doctors do on the same side.
If I remember correctly, was that you that who said that, well, say for the recreational the implants, and then the young people are happy actually to put their cardiogram or the blood pressure or whatever health information online without hesitations. If that trend is true, actually, and it happens in the United States as well, but if it's true here as well, then that actually could formulate a large social network. Even though Google once tried upon doing that, they stopped doing so. But it could be for the same kind of diseases have a pretty big power compared to the hospital-based treatment.
Definitely, I think so, and it's the same trend in Europe. Definitely, that many people buy these monitoring devices and upload their things to Facebook, and I think it's a chance, but yet all these products are not medical products, so they are not certified. They're just like lifestyle products today, and they really got it to sell them via this consumer electronics method that worked. And that's I'm wondering because I never would upload my blood pressure to Facebook, but people do. Actually, that's a chance. Yeah.
I'd like to comment on this because I think the consumer electronics is very good in marketing. You can see here on this conference, and especially if you go down the halls here. But the problem is that health is a different topic. This is something, if it becomes really something which is life critical, then we treat this with much more of ethical and also regulationary type of boundary conditions. And I think that's finally the biggest challenge we have to solve here. We are talking not about something where people have fun. We are talking about something where people really have big problems. And that's where we have to make the difference. And I believe that there's a lot of change necessary in many places in this society to get this really happening. I don't believe that this is such a fast trend and that we can fulfill the same speed of progress here that we can do in the consumer electronics, simply because the boundary conditions do not allow us to do so.
Yeah, nowadays the internet is becoming so powerful. Everybody, got so connected and bombarded by all kinds of advice, information, not only from the reliable professional, but also from any average person. So, as the saying says, garbage in, garbage out. So when we download an application, we have to be careful that this is authored by some very reliable, accredited organization, reliable, secure to use, and also maybe those a healthcare professional can take a more active role, to make sure that they have some kind of website to provide very good recommendation. Otherwise, people will be ill-advised. Okay, now let's move on to the next one, which is the aging population. Now, this is almost becoming the buzzword of our conference because about everybody is talking about this, and you can see that according to the prediction, by year 2050, 65 and over, the population will be about 1/5 of them. And as you can see, that the lower one, this is the number of disability, and you can see that the general trend is that when you get older, the likelihood of have some kind of disability is getting higher. So we can see that when our population is getting older, we are going to see more and more chronic conditions. So I just listed here some of the possible strategies to tackle this problem. Is that home-based telecare, telemedicine, or low power, low disturbing sensors, wearable sensors, body area network, so that it can be continuously monitored without too much disturbance to the everyday life. Mobility equipment, robots. And mobility means something like we want to have an easy to use wheelchair and that kind of thing, and robots and others. So, anyone want to pick it and to give you
for the aging population? You see, a lot of the aging issues are chronic issues, and there is this patient's initiative, the patient's behavior is very important in maintaining a relatively normal health. So it's very important that those things get monitored, not just by the doctor. I mean, it's not like only 1 week, 2 weeks before your doctor's appointment, you start getting more vigilant about, okay, I have a doctor's appointment in 2 weeks, I need to start exercising now, probably, so that my results get better. But if, let's say, you have a consumer electronic product, and I'm sure there are plenty of apps like that which help you manage and keep a daily record of where you are, and so that gives you a motivation as well as some kind of pressure comes in from the device itself, that you got to keep track of when you missed it, and to make sure you are on track and you have a certain goal to meet. So that gives a lot of motivation to change the behavior, and those things help manage better for the patients. And within the telemedicine arena, to connect any available doctor if I want to talk to a doctor in the next 10-15 minutes, I should be able to push a button on my phone and connect with a doctor available who is aware of my condition and can manage and advise me right then and there. So those things are already are happening now. A lot of these applications are being developed. The challenge is how credible, how reliable, and by following all the regulatory norms, in those frameworks we can adopt these things as time goes on. So these things are already, new business models are being created, new businesses are already doing these things in place, and you will see more and more innovation in this kind of space to manage through telemedicine.
Yeah, I think telemedicine is one of the most important points. I agree completely. And the second one is mobility. Mobility is quite important for the elderly people still, and will get more and more important because people are more and more mobile today. And there are big efforts done, but not enough in the moment to keep mobility for elder people. Like we saw yesterday, the wheelchair that is going over steps and these things. And I think if you talk about, because you mentioned the robots here as well, the robots can do a lot in home care as well. If people cannot bring the people to another place, to the bed, to the bathtub or something, but with the robots, I think you always have to think a lot because the robots don't have to be there alone. There should always be some human being to use them, to control them, because it's kind of a weird imagination that a robot is alone in charge of all person at home. So I think these systems should be designed like systems that are user-centered, used but not alone.
Well, one example that I personally see in the past is that for those, some of the patients, they are about, I think, more than 300 pounds, and it takes more than 2 nurses just to try to get him on the cart, and it's so difficult. And so imagine that if we have a really powerful robot, well designed, you can easily carry it.
And it's yet very threatened to the health of the nurses as well. We should think about it.
I'd like to add a different aspect. I think I fully agree that finally every electronic device needs to be built for the sake of someone who is using it. But and this brings me to technically a very different challenge. I think today most electronics we are building needs a power plug. And if you talk about mobility and the power plugs, then there's a certain amount of limitations in there because the plug always needs to be somewhere plugged in, and this limits your mobility. And I think if you really think about breakthrough technical ideas, we need to get rid of all these power plugs with everything. I think low power is technically one key enabler for many of these applications. The same is true if you're going for body area network, for distributed sensors, for all these healthcare applications. I personally hate to put my cell phone every day in a power plug today. I think that's already something which is annoying me because I know technically it could be done much better. But I think for elderly people, putting this device in a power plug every day or every few hours is something which is basically breaking the whole business model, speaking economically. So we need to really challenge getting to lower power, lower energy consumption of these devices. I think that this is the technically biggest challenge we have to solve in here.
Anyone to add?
I just want to add, I think just from looking at a lot of the topics that have been covered just at this conference, we can see what a very important topic this aging population and consumer electronics is. I think this also ties back into cost because when we apply some of these exciting new techniques and say preventative techniques, for example, some of the things that were presented at the conference and other places, being able to anticipate, say, some sort of instability and giving an alarm so that the patient knows to modify their behavior and prevent the fall and a long hospitalization that can ensue. This is a huge change that can affect costs and also just engaging the patient or these elderly people in society by these enabling technologies, these mobility equipments and assistive technologies. This is also has been proven to help with health when you engage these elderly people in activities. And so I think there's definitely a lot of contributions that are upcoming and very interesting.
Yeah, so you're talking about consumer electronics can have some smart device that can help aging people to stay living independent.
Right.
Yeah, that's very important. You want to say something?
Again, here I have more questions than answers, I believe. But one is for aging population, the one important aspect is probably the embedded signal sensors for cardiac or the metabolic signal being detected, or even brainwave being detected and constantly being monitored in a safe manner. But that's probably something you're going to be speaking in the next talk, I believe. So I don't really touch upon it too much at this moment. But the other side of the story, which is going to be probably interesting arena for the consumer electronics, is to enhance the lost functionality of aging populations. Say, for example, if you have fragile legs, hands, or whatever things, or even memory sites and stuff like that, then in consumer electronics, I believe there are technology already in place to enhance those lost functionalities when people get older. Say the power suits kind of things, which is of course only in movies, but is now able to do it. And I see some of the in the show here as well, the how to enhance actually your walking experience by kind of the boosting shoes or something like that, being equipped with some sensors in it. So are there any consumer electronics industry opportunity for not only censoring but also the enhancing those aged population's functionalities?
Okay, we are running short, so but we like to have some feedback from the audience. So if you have burning questions you want to bring up, please go to the microphone and please.
Thank you. It was an interesting presentation and comments so far, but I'm missing one big thing here. We're talking about possibilities of using the cloud, all electronic systems for medical healthcare. What's missing here is the disaster situation. You have an earthquake or something like that knocks out your grid. We had it just recently in Japan. You have no more cloud, you have no more connectivity. You need to look at backup systems and look at the reliability of systems. Not a comment that was made before too about the ICs from Dr. Brederlow, reliability between medical devices and consumer devices. I think the gap is narrowing. I know NASA has started using consumer devices because the consumer electronics industry is very cost sensitive, and failures of consumer products can ruin the profit margin of the product and kill the product off. To that effect, the consumer electronics industry is probably the industry which has been the quiet achiever in reliability. And I dare to say that a lot of the consumer devices these days are up to medical grade, if designed properly, if the companies who design them are experienced enough and understand their reliability programs as well. And then there's the other thing, we talked about 240 volts and so on, so product safety aspects. And so we're going around the circle, but I think that our industry, if the skills that we have in the consumer industry can be translated further into the medical sort of side of things, we have a lot to offer. And I see this as a win-win situation for both sides.
Okay. Maybe let me comment on this as well, because I think you're directly addressing the difference in quality. I agree with you completely. There is nothing which can't be done. The question is always, do you want to do it because of cost? And I think the cost trade-off between quality and what you're willing to pay is a different one. If it's a life-critical application, or if it's something which you just use, or if it's broken, throw it away and take a new one. I think that's a challenge. And technically speaking, in a semiconductor business, we are definitely doing differences in the way how we test for quality, for example, in the automotive market, than we do in a consumer market. And this translates into cost. And we have to charge these costs, because otherwise it's not a profitable business. So I think there's a difference. I agree with you. This is mostly a difference in logistics, in how you handle the devices and how you develop the devices. And it's also a difference in the time it takes from a first product to a big market volume. But it is something which is not a technical challenge. It's just a different mindset in the way you're doing your business.
That's correct. And actually some of the research I'm actively doing at the University of New South Wales, I'm addressing the information they're using. And I think engineering as such in general is wasteful in data. We generate a lot of data in the product development process. It starts from concept development right through to production, and we don't know how to integrate the data. So what we're doing is, as you're saying, is we do different levels of testing. I sort of believe at this point in time, in a typical product development process, 50% of the tests are redundant, because we don't know how to interpret previous results and extrapolate from previous results to current results. And if we can manage that better, I think the distinction between, say, a medical device and a consumer device will be lower. But I also think, looking at the cost effects, the long-term cost effects of a consumer device, we need to bring the costs down, and overall whole-of-life costs I'm talking about right now, and whole-of-life costs can only be brought down by having efficient reliability and safety testing, because both reliability and safety tests contribute significantly to the life cost cycle. And if we get that, manage that better, it's just something that's going to be happening for the next few years. We'll bring the overall costs down considerably. So what you're saying is true, but I think we're still in the early stages as we evolve.
Yeah, it's a balance of. I think it's a balance of risk versus how much cost, the willingness to pay is there,
Yeah.
and also at the same time, the marketplace will decide. Just as in consumer electronics, the winners ultimately they one win by having better products, reliable products, and in medical arena, partly the job has to be done by the regulatory bodies as well as the companies who want to be in the marketplace in the long run.
That's right. What I'm saying is too is that the way we're testing the moment, we're not doing it efficiently enough.
Yeah, that's true. I mean, pacemakers, there's always in the news, pacemakers are being hacked, the routers are being hacked. So things will happen, but have the contingencies have been done, has the risk been mitigated, those kind of issues will keep coming, and there will always be more challenges, more and more, but we have to address it, continue to address it. It will never go away. I mean, that's the reason why Intel paid $6-7 billion to buy the company McAfee, the internet security company, because that's the next wave of things, is the Internet of Things. When we all connect all these devices, they're all talking to each other. It's M2M, machine to machine, and that's when these reliability, credibility, security, all these things come together, and risk becomes the biggest things to manage.
Yeah. And the ethics of it all as well.
Yeah, absolutely.
And actually, by the way, there's a new field of study emerging now, we talked about robotics before, where we actually have people studying robot ethics.
Okay, thank you. Okay, let's allow one more question. Okay.
Yeah, thanks for the great discussion so far. I would like to maybe hear some comments on how simple consumer devices enable different kind of medicine. Like, for instance, I saw downstairs a watch that measures your heart rate without any belt. Something that you can use during the whole day, during your whole life. And I'm not sure about the reliability of it, but probably it's enough to actually predict a lot of different problems that I will have in the future that will require all these great devices, imaging devices, etc. But maybe on the prevention side, that can be quite a game changer if indeed this data is uploaded and benchmarked against the rest of the population. So I would like you to comment maybe on the changes in healthcare that these devices can enable on processing these large amounts of data, and how medicine can then be more reactive and work more on the prevention side rather than reacting to very clear advanced symptoms. Thanks.
So I think, I'll just quickly take a hash at it. The data collection will happen, and there'll be more data always will be gathered from about your personal medical, whether it's a heart rate or pulse rate or pressure readings. The idea is what interpretation you want out of it, and the key thing becomes here is data analytics, and that's a field which is the hottest field right now, which a lot of people are focusing on. How to interpret data, how to put it together, how to make sense out of it. Making sense out of the data will be the biggest challenge. And those groups, those professionals who will do a better job at this, whether communicating to the doctors or communicating to the patients, or when you want to compare your own lifestyle with your data and try to get some sense of interpretation, that will be the key challenge. And how do you do those data visualizations and analytics? That becomes a key part of the whole sector, and that's a very rapidly evolving field right now. Thank you.
Dr. Shieh, you want to add something?
I just wanted to further comment. Yeah, I agree, and I think just with the opportunity of this explosive amount of new data and just the statistics that come out of that, I think there's a lot of opportunity for finding a lot of interesting correlations, and but at the same time, there's various different devices and the shortcomings and peculiarities of each, and I think that's also another issue that will probably limit the amount of generalizations you can make across devices. But of course, from just purely medical perspective, if there are known devices that are reliable enough, and these can pick up certain known medical markers. I think that could definitely alert people, like with the watch and just basic sort of pulse tracings. This could definitely alert users to visit a physician if there's
So I belong to ST Microelectronics. So thanks a lot for your interesting talks. My personal interest when I look to healthcare is how this is going to impact embedded systems. So I saw your presentation, Professor Yoshida, about these consumer electronics oriented devices. The challenge that I see is that these systems are quite costly and drain a lot of computational power. On the other side, the embedded systems are getting more and more powerful. So I would like to understand if you have any opinion about the trends of moving some functionality that you showed in your presentation toward the embedded system, if they are going to be powerful enough to sustain such functionality. And then the second question, which is quite general, is that also when I look at the healthcare system, sensing is important. And how sensing is going to be correlated to typical diseases, like, for example, Parkinson. So if you can share any comment on that, would be nice. Thank you.
Thank you for asking the questions. Again, I have more questions than answers, but anyhow, your points are very well taken. The power embedded system, I think, is going to be more popular in medical devices and medical applications, not only the one I presented, but other ones. Particularly for mine, certain algorithm being developed for certain disease treatment or the diagnostic purposes. Then once they are discovered, then they're going to be fixed, and then it's much more efficient to be embedded and cheap to be distributed. So the trend is that probably things going to be going to the embedded system. And answering your somewhat second question, which is probably related to the question you answered, probably I see the contribution from the consumer electronic side is going to be more concentrated on embedded systems in home devices. Okay. So you asked the questions about how those monitoring system will be able to affect the future healthcare. One of the interesting idea being experimented at MIT, for example, is that you take the face of yourself or of somebody, come every morning when they come, but not intentionally, but when they come to the bathroom, okay, and then keep a record of that actually for many years, and then compare the change of the face, so that it's going to be related to any type of diseases or predict any symptoms, which even a person being taken the data are not realized. Okay. So however, this has so that actually comes with embedded systems. So embedded some of the nice face recognizer into the glasses, okay, and bathroom, and then in the intelligent bathroom, the glasses, and then you are able to actually monitor, or you are able to be monitored for a long period of time, and then that would be able to actually affect the person's health care a lot once enough number of data is obtained. The only problem is that, as you asked, how you are able to medically significantly correlate the findings or the signals being acquired to a particular type of diseases, which is actually probably for a long period of time and probably for the future stays as a big problem. some data mining method being used for finding some correlation with data being taken, or some of the supercomputers like the IBM Watson using some of the artificial intelligence. It's a little bit old word now, but the machine learning nowadays are being used for the data mining, those correlation between the data and the being taken every day, and then some type of diseases. Probably that's the area where the medical research needs to be more focused on. But before that, we need to have some of those devices available in order to collect the data, and volunteers actually to upload those data, like young guys, upload cardiograms on their website, in order to see all those trends. And research going on for integrating those distributed database on the web, and in order to integrate and derive some meaningful data out of it, which is, however, still undergoing. So it's still an open question of how those collected data are able to be really meaningful in terms of the disease prediction and hopefully disease treatment as well.
Well, we have run out of time, so we have to stop here. But I believe that you have all enjoyed a very inspiring and interesting discussion. But this does not mean the end of the discussion. After this, you are welcome to grab them and continue the discussion, or even exchange the business card to carry on the discussion indefinitely. And finally, let us give them a big hand to show our appreciation. Thank you very much.